Hi, my name is Simon Radmore and I'm the Executive Director for Strategy and the Office of the Chief Executive in Northern Sydney Local Health District, a public healthcare organisation in New South Wales, Australia. I would like to begin by acknowledging the traditional owners on all of the lands we are on today and pay my respect to all Indigenous communities and people. Today, I will be exploring the issue of health equity in Australia. Australia has an ageing population of 27 million people with a median age of 38. Australia has a universal healthcare system known as Medicare, providing publicly funded access to essential health services. New South Wales, the country's most populous state with a population of 8.5 million people, operates a vast public health system through local health districts. One of these districts, the Northern Sydney Local Health District, serves a diverse and largely urban population of about 1 million people across Sydney's north. Australia's GDP per capita is approximately $64,000, with a growth rate of 1.4%, and Australia spends about 9.9% of total GDP on healthcare. Australia has generally high healthcare access and positive health outcomes with a Gini code of 0.324. In Australia, the average life expectancy for a woman is 85 and is 81 for a man. Infant mortality rate is 3.2 per 1,000, and despite high rates of chronic disease in an ageing population, Australia performs reasonably well when it comes to burden of disease when compared to many of its peers. However, healthcare and health outcomes in Australia are not universal, despite Australia having a high-performing universal healthcare system. One group that experiences health inequities in Australia is the Indigenous population, who represent 3.2% of the total population. The life expectancy for Indigenous women and men is 76 and 72 respectively, a difference of 9 years compared to the non-Indigenous population. The infant mortality rate is 6.3 per 1,000, almost twice the non-Indigenous rate. And the Indigenous community also has higher prevalence of chronic conditions and poorer health outcomes. Healthcare inequities for Indigenous Australians stem largely from intergenerational trauma, a mistrust of healthcare and government systems, discrimination, broader social determinants of health, geographic and service accessibility, and inflexible healthcare delivery systems. Nationally, Australia has committed to Closing the Gap, a program of works that commenced in 2008 and are a commitment from all Australian governments to fundamentally change how we develop policies and programs that impact on the lives of Indigenous people and to address the gaps that exist between Indigenous and non-Indigenous people. But despite this focus and much investment, the gaps remain. It is clear that there is an equity issue and a new approach is required. A strategic and targeted approach to diversity, equity, inclusion and belonging is essential to ensuring equity for this population and many others, and it is something we are committed to at a national level and strive to achieve in Northern Sydney. It is clear, good intent though isn't enough, and more action is required. There is a combination of national, state and local plans that connect and guide the approach to Indigenous healthcare. In terms of practical actions, the National Closing the Gap Agreement has 19 socio-economic targets, and 3 of these are focused on health outcomes, particularly that Indigenous people enjoy long and healthy lives through increased life expectancy, are born healthy and strong with healthy birth weights, and enjoy high levels of social and emotional well-being through reduced incidence of suicide. To support these aspirations, in 2024, the Australian government implemented a number of initiatives and reduced the cost of medicines, increased the Indigenous health workforce, improved critical health infrastructure, and supported a review to improve aged care for Indigenous people. At a local level, in line with the national approach, Northern Sydney's approach to Indigenous health involves targeted strategies such as community engagement, a dedicated workforce providing specialty services and support services to navigate mainstream health systems, workforce education and cultural competence training, acknowledgement and recognition, and strategic planning to ensure services are delivered in a coordinated way that meets community needs. Despite all of this, national and local gaps remain, and in some cases, gaps are increasing. In early 2025, the Australian government recommitted to closing the healthcare gap by targeting chronic and preventable disease, improving access to culturally safe health services, maintaining gains made towards improving healthy birth weight, and addressing the preventable loss of lives and improving mental health, social, and emotional well-being. But how are we going to do this? Built on the overarching principles of self-determination and enabling policy, the focus moving forward at a national level will target enhanced preventative health, development of culturally safe health services, building on success and maintaining gains, improving mental health, social, emotional and well-being, and continuous access to dietary needs. At a local level, this means expansion of services, ongoing and expanded community engagement, continuous education for staff and community, development of novel clinical and workforce models of care, and embedding Indigenous healthcare as a responsibility for all healthcare staff. These access inequities are not confined to Australia, and we certainly don't have all of the answers. Indigenous communities around the world are impacted by access inequities and generally poorer health outcomes. We need to engage as a global community to support and strengthen healthcare for and with vulnerable and diverse communities, delivering the services they need in a culturally safe and welcoming environment. Ensuring access and equity in vulnerable and diverse populations is the embodiment of person-centered healthcare. This requires us to meet these communities where they are, engage genuinely, co-design, adapt to the local context, and take a whole of government and sector-wide approach. We need to live the phrase, "nothing about us without us," where no policy should be decided by any representative without the full and direct participation of members of the groups affected by that policy. Australia's Indigenous population experience inequity and reduced access across the lifespan, and there is opportunity and obligation for us as healthcare leaders to support and intervene at each step along the way. Whether it's Indigenous populations in Australia, rural populations in Saudi Arabia, women and children in India and the Northern Mariana Islands, adolescents in South Africa, or any vulnerable population, all global citizens have the right to healthcare access and equity and the right to start well, live well, and age well in their context. Despite significant healthcare advances, healthcare excellence, access, and equity is not the norm. Best estimates indicate 60 to 70% of the world's population experience some form of health inequity. That's anywhere from 4.5 to 5.5 billion people. The Australian experience with the Indigenous community shows that it takes more than good intent and resources. It takes novel thinking, enabling policy, and self-determination. And above all else, a leadership commitment to change. Thank you.